Are you hesitant to jump on the clear aligner bandwagon? Don't let bad information out there hold you back. Watch this video to discover the truth about the 7 most common myths about aligners and see how they can benefit you and your practice. Don't get left behind, tune in now. So let's start off by defining what are aligners. Aligners are a type of removable orthodontic treatment that puts pressure on teeth and moves them into the desired position. Myth number 1, aligners are not as good as metal braces. This is a super common myth, and honestly, it's very old and outdated. Back in the day, when aligners first came out, they were not effective at moving teeth. Over the years, millions of dollars of R&D has been poured into clear aligner therapy, and today it is very predictable and just as effective as metal braces. Sure, some cases you cannot achieve the movement with aligners, like molar distalization, but that's okay because you don't have to do that as a general dentist. There is a place for metal braces, and there are certain cases where metal braces will be more effective than aligners. But the opposite is true. There are so many cases where aligners are actually more effective than metal braces. Closing anterior open bites, for example, are super predictable with aligners and can be a little bit more challenging with braces. Solving minor crowding and minor spacing cases, also super effective with aligners, takes a lot longer to do with metal braces. The material that aligners use is called thermoplastic. There's a bunch of different variations of this out there on the market. Every brand has their specific plastic, but at the end of the day, it's plastic moving teeth. Myth number 2, aligners cost more than metal braces. So like anything in the world, depending on where you live, the price of aligners can change. Also, the price of aligners can change based on the complexity of the case as well. But on average, aligners are anywhere from $3,000 to $8,000. The cost of metal braces, though, can also vary. This is also dependent upon type of treatment. This is also dependent upon the type of the case, the length of the case, and who's doing the case, an orthodontist or a general dentist. Now, I don't really like making dental insurance be a dictating factor on whether or not patients should go forward with treatment, but there are some dental insurance plans out there that do provide coverage for ortho, and that coverage is applicable to both aligners and metal braces. So if you take insurances, always be sure to have your team check to make sure that any patients have ortho coverage. If they do, the ortho coverage can range anywhere from $1,500 to $3,000. That's a huge chunk amount of money that insurance is willing to pay for treatment. This further helps make giving aligners to patients even more affordable. So to wrap up myth number 2, the cost of aligners compared to braces all depends on a couple factors. The length of treatment, the difficulty of the case, who's providing it, whether it's an orthodontist or a general dentist. But at the end of the day, you're gonna get a lot more flexibility and honestly compliance with aligners compared to metal braces. The reason being is patients are going to be more willing to do aligners than metal braces because of the fact that they're not going to have metal brackets and wires on their teeth, and the aligners are virtually invisible and they're able to still function in their day-to-day. Myth number 3, general dentists cannot do clear aligners. Right now, that's a myth straight up because I am a general dentist and I do aligners, and I've learned from general dentists and I've learned from orthodontists on how to do aligners, and there's thousands of general dentists out there that are trained and able to do aligners predictably. This stuff isn't rocket science. It's plastic moving teeth. You do have to undergo some type of training to understand core principles and fundamentals of moving teeth. But at the end of the day, you can learn it if you really want to. It's important to note that any provider, whether it's an orthodontist or general dentist who wants to do aligners, they have to take additional training for it. Yes, that means orthodontists do have to take additional training to provide aligners. Same goes for general dentists. It all depends on you as the provider as how much education you want to get before you start taking action. Myth number 4, aligners don't work on adults. So this is a big myth because moving teeth is not just for teenagers. Yes, when you try to move teeth with teenagers, it can be easier than with adults just because when teenagers are growing, their bone is also growing in their jaw. So the tooth movement becomes a lot easier to do. You can do things like expansion a lot easier in a teenager than you can in an adult. However, you don't always need to do expansion to have a successful case with aligners, especially in adults. In adults, you can use aligners to treat cases like spacing, crowding, overbites, underbites, and even crossbites if you want. Some of those cases are going to take a little bit more time in in aligners, but at the end of the day, aligners can still pull it off. Honestly, aligners are way more effective in adults than they are teenagers, in my opinion, because of compliance. An adult is way more willing to wear aligners for 22 hours a day and stay regimented with the treatment. Teenagers are a little bit more prone to laziness and they may not comply because having to take in and out your trays every time you eat is another responsibility. No offense, teenagers, but not all you guys are that good about being responsible. Myth number 5, patients don't want aligners. Okay, this is total BS. Patients love aligners. If you are a dentist and you're doing a couple cases a month, I can guarantee you it's because your patients are telling you they want aligners, not because you're actually talking about it. There have been millions of dollars that companies like Align have poured into advertising and marketing aligners to patients directly. So the patients are already aware that this is a procedure that can benefit them. And so they go knocking at their dentist's door wanting it. The problem is a lot of general dentists don't offer it. So get out of here with that BS saying that patients don't want this treatment. They literally are begging for it. You just need to open your mouth and start doing it. Also, if there's 2 ways to move teeth, one of which is metal braces and brackets and wires, and the other is this like clear invisible option that they can take in and out, brush, floss, and keep their mouth healthy while they go through treatment, don't you think that they would want that version more than the other one? Myth number 6, it takes too long to implement. Well, I can say from personal experience, it takes very long to implement something in a dental practice if you don't know what the heck you're doing. So if that's you, that's probably why it's taking you that long. It's gonna take you even longer to implement it if you don't believe in the treatment. If you genuinely believe that the treatment that you're offering will work, you are going to implement that like this. You're gonna make it happen, I know you will. Because a determined dentist gets things done. That's you. My recommendation is to arm yourself with education so that way you can get more confidence and belief in the treatment. Get yourself a mentor so that way you have someone to lean on in case you ever get stuck and have questions. And dive in headfirst to this stuff. I created a free masterclass just for you if you're someone who's interested in learning more about how to do aligners. I'll walk you through step by step how you can start doing 3 more aligner cases tomorrow. The link for that's in the description below. Okay, myth number 7, cases always end in posterior open bites. So this myth is what every older dentist will tell you about aligners. And the reason is because when aligners first came on the market, remember how I said they weren't that effective? Well, what happened is all the early adopters who did aligners, they weren't getting all the movements that were planned. That wasn't the dentist's fault, that was the technology's fault. And so what happened is, let's say they were trying to intrude the mandibular anterior teeth, but the aligners didn't actually achieve all the movement that was planned. So what happened is that in the posterior, they got the movement that they wanted, but in the anterior, they didn't. This then caused the teeth in the front to come together before the teeth in the back came together. So what was the result? A posterior open bite. Posterior open bites are very tough and very tricky to solve if you don't know why they happen. So what happened is early on, a lot of cases were ending in posterior open bites and the dentist got scared and then they didn't trust the actual treatment, so they backed off. I can't blame them though. If all my cases ended in posterior open bites, I would stop doing aligners and I would just do regular dentistry again. But that's not the case anymore today. When you set up your cases properly and you get the movement that you're planning on getting and you know how to troubleshoot if a posterior open bite happens to happen, you're gonna be just fine. Again, invest in yourself and education to learn how to do these cases correctly and you won't have any issues. So there you have it. Those are the 7 myths that surround clear aligner therapy. And honestly, if nobody debunked these, they would dishearten a lot of people from taking on more cases. So I don't blame you. Hopefully this video helps show you that aligners can be just as effective, if not more effective than metal braces. They can cost pretty much the same, sometimes even cheaper, and it's suitable for both adults and teenagers. Again, this treatment helps your patient's oral health. And if you don't know how to do it right now, I highly encourage you to learn how to do it. This is how you're gonna level up as a clinician and provide excellent care for your patients while also getting some more time, money, and fulfillment back in your life. If you're still interested and you're someone who wants to hear more about aligners, check out the next video in my clear aligner series. You can also follow me on Instagram. I post aligner content all the time and I post daily motivation videos for dentists. If you enjoyed this video, please drill that like and subscribe button, but more importantly, share this with a dental colleague. My goal is to give as much valuable information as possible with fellow dentists so that way we can all be better. Thanks again for watching. I'll see you in the next video.